Terrific. Thank you all very much for the opportunity to be here today. I'm Ferree, and I'll be talking a little bit more about partnerships with industry. Today I'm going to cover a bit of an overview of partnerships with industry that we've been involved in for the past 12 years, as well as other collaborators in this space. Talk a little bit, building upon some of what Richard talked about in terms of some specific elements of successful partnerships, and then end up sharing some results of the early work that we are doing with a current set of agreements with both the beverage industry as well as McDonald's, but also just touch upon the importance of measuring the results and sharing what we're learning on an ongoing and transparent way. So first, just a little bit of an understanding of how where we come from in approaching this topic. The Alliance for a Healthier Generation, as many of you know, was formed in 2005 as a joint initiative of both the American Heart Association and the Clinton Foundation. And what we brought to this space in the public health world was a matching of the rigor of the scientific evidence that the Heart Association was bringing around children's health, as well as with an approach to begin to really look at some systemic changes that we might be able to have an impact on for some of the early work that the Clinton Foundation had done related to HIV and AIDS. Our mission is entirely about children's health. We work to really transform the environments where children and their families are, and we do that with two fundamental approaches. One is really by looking to transform the marketplace, which is what I'll focus on today, but also harking back a little bit to yesterday's conversations about the social ecological model. It's not enough to just take a look at what's going on in the marketplace, but really matching that with what we're doing to make community healthier, community environments healthier. And we work specifically with schools and after-school programs and summer camps around the country, as well as juvenile justice facilities and with partners in the early care and education space to really look at matching these systemic changes with the barriers that practitioners in those settings face and the families that send their children to those locations face as well. So we believe, like many of us in this room, and as we talked about yesterday, that there is not one cause for where we are in terms of the rates of childhood obesity and other children's health issues, and that therefore there can't be one solution. And when we were founded, we were designed with the intent to really work with companies to transform the marketplace. So I'm going to share a little bit about the success that we had with that in the early days, which is really the foundation for our continued work in bringing the business sector to the table. The very first agreement that we brokered was with the beverage companies, specifically the American Beverage Association, along with the Coca-Cola Company, PepsiCo, and at the time it was Cadbury Schweppes, now Dr. Pepper Snapple. And at that point in time, sugar-sweetened beverages were widely available in the K through 12 school system in the U.S. We created voluntary beverage guidelines and asked the companies to step up and meet those guidelines, and at the same time worked with schools to implement those voluntary guidelines, which predated what the USDA now has in place in terms of policy. So there was a lot of us working in this space at the time, and this was one of the ways that we could play the role that we were designed to play in really bringing companies to the table and begin to do as much as possible in a proactive manner. At that point in time, the companies agreed to phase out sodas, full calorie, full sugar sodas, and shift their product mix and reduce their portion sizes. So they specifically created products for the school environment. And it's important to note that like all of the agreements that we and partnerships that we enter into with companies, we always have an independent third-party evaluator at the table to evaluate and contribute to the research base. The results of this early agreement, as Richard mentioned, had a really, really dramatic impact on what beverages were being sold to schools. The evaluator was Keybridge through Dr. Robert Westcott, and created a way to really measure what was being shipped to the schools through all of the distribution channels that the companies had, which is a very complicated system. The companies do not directly sell to schools, but they do that through their distributor network. There was a 40% reduction in the beverage calories shipped to schools. As you can see some other statistics from that study, the bottom one, a 94% reduction in the volume of all of the restricted beverages, which included juice drinks, flavored waters, and teas against those beverage criteria. So these early results really led us then to continue this work. And you can see here just a real high-level overview of the types of agreements that we have entered into with companies since that time. I'm going to focus today a little bit more on the second agreement that we're in the middle of with the same beverage companies, as well as with some work that we've been doing with McDonald's for the last few years. But our work is not entirely focused on the food and beverage sector. We also work with the healthcare sector, with health insurance companies, as well as self-insured employers. And so this model of partnering with business is something that we believe and have had success in really looking at across a number of sectors, and we believe that there is actually a place at the table for every single company in this country, not only the large ones, but all of the small ones in the communities where our families are living and raising their children. So with this belief, that early work has led us to adopt, begin to really learn a lot and adapt what we're doing and perfect this model. And I'll share some of those findings. One of the things that I think, this is a quote from our CEO, Dr. Howell Wexler, that I think really encapsulates our philosophy, that this work isn't about one agreement and checking it off the list and being done with it. We're going to be at this for a while, and that's why it's important for us to establish long-term relationships with these companies and continue to set targets together and continue this work. So what are we learning? I'm going to cover a little bit about what we're learning through our agreements, but also some of the things we're doing with other collaborators, some who were here yesterday and in this room, and others outside of this room. First off, one of the ways that we approach the work that we think is critical is to analyze the entire system, not just to think about it as let's talk to one company about one issue, but really look at where the gaps are, where the problems are, try to really understand the issues to the full extent possible. This is just a real simple diagram of the food system, but that's one of the ways that we identified that the beverage companies and then the snack companies and then the school meal manufacturers were the companies that we needed to ask to come to the table and step up and meet certain criteria for schools. And that's exactly the same model that we use in healthcare and in the other sectors as well. Really looking for those gaps and then figuring out how to fill them, either ourselves or with partnerships. So there isn't always one way to do it. It depends upon what comes out of that research phase meant to tackle some of these barriers that families are facing. Another learning for us is to bring an entire sector to the table, or the largest companies that hold the greatest market share. This is really challenging to do, as many folks who work with companies can understand. One of the ways that we really believe that success has been able to occur is to bring information, share the information and the research to create a shared vision and some shared value together. As Richard mentioned, there are individuals in these companies that firmly believe everything that I know I personally believe about children's health, and it's finding that shared and common value, which is the basis of forming these relationships in the first place. There are complexities to collaboration across companies in the same industry, but we believe it's worth it because the impact can be even greater, and it can level the playing field so that more companies can step up and do this, share the lessons to some extent, but also really level the playing field so that they're not the ones taking the hit from a shareholder value perspective. Because remember, their motive is profit. So it's an entirely different structure to that sector, and that's where we're trying to find some common ground. We also, in terms of evaluation and in sharing data, have to look really carefully at how we capture that and make sure that confidentiality is maintained so that the companies still, again, in their own best interests, are looking to capture greater market share. So it's important to understand that. If an entire sector won't come to the table, then what we are looking at is really what is the creation of a domino effect. So in the case of removing soda off of the Happy Meal menu, McDonald's stepped up, signed an agreement and a partnership with us that includes other aspects to children's health, not just the removal of soda from the Happy Meal menu. And then the other companies started to follow based upon some great work, of course, of CSPI and Moms Rising and other of our partners in this space. And so there isn't a one-size-fits-all sometimes to what really gets the companies to partner in a meaningful way to drive change. But it's important to note that sometimes one large company can make such a difference that it's worth going ahead and working with them in a really concerted way. There also may be industries that don't have a professional organization that can really round up, if you will, everybody and bring them to the table in a really meaningful way. And so the beverage agreement is very different in that regard, where we work very closely with the ABA and the work that they're doing directly with the companies across the country. Similarly, with the health insurers, we work with 20 of the largest national health insurers in the country to provide preventative benefits to children who are at risk or overweight, at risk of overweight or obesity, and work also with the American Academy of Pediatrics and the Academy of Nutrition and Dietetics. And so looking at it from that holistic industry-wide way is really an important element of successful partnerships. Another lesson for us is really working, getting that top-down support and working towards long-term partnerships. And this is important because there are changes in leadership within the companies, and we maintain a relationship with every CEO of every company and have for the last 12 years. And so even as there are those leadership changes, we're working with champions, high-level champions within the organizations to understand their issues. They're watching the market, we're watching the market. We're not in their business, we don't know all the details, but we do make it a point to understand what they're going through on any given day, because it's affecting, again, what brings them to the table, which is their profits. In the case of our healthcare work, just as an example of a long-term partnership, we started with the partnership around the preventative benefits for the prevention of childhood obesity with the health insurers, which included them agreeing to reimburse for 4 visits to a pediatrician per year and 4 visits to a registered dietitian per year, so for families to receive that nutrition counseling. We are now in a really wonderful place with that group of companies where we're able to talk about their Medicaid business, and so we started with the commercial business because that was something we needed to put in place and start to tackle in terms of preventative benefits that predated the Affordable Care Act, and now we're working with them on a whole nother set of projects. So the long-term relationships are definitely important for us to continue this work together. Our current agreement with the beverage industry is built upon these long-term relationships, and for many years we explored with the companies what we would do next about the continued problems that we're facing with being able to really change customers' behavior towards products with less sugar and less calories. So these are some of the in-depth components of that agreement. I'll talk in a minute about both the national and the local goals. But in particular, they have agreed to continue to promote the calorie awareness and the sugar awareness on all of their company-owned equipment. So that's about millions of vending machines, retail coolers, and fountains in restaurants across the country. They also, as Richard talked about, are stepping up their reformulation and their innovation efforts to meet the goal that we set together. And that includes everything from not only their products themselves, but their distribution channels, their marketing, not only to change things for a little while, but to completely transform really our palate for these beverages. And then a really critical part of this that the companies recognized, the ABA recognized, and we recognized is that it isn't enough to just try to put some new products on the shelves. we really have to work at this at the granular community level. And so it's really important to leverage the relationships that not only the beverage companies already have throughout the communities where they are working and living, but also bring other of the organizations, many that we work with and many in the nonprofit sector work with, to understand what we're trying to do to share in that common goal and to figure out how on a granular level to make sure that every store owner, every restaurant owner really understands what we're trying to do and take a risk to put different things on the shelves or to do some taste testing and some sampling and some ways to help us shift what we're going into the store and looking for in the first place. Speaking their language, I talked a little bit about this already, but the importance of really understanding where the business is coming from is critical, but also not just to understand it, but really challenge their thinking. Many folks in the companies that we work with aren't living and breathing public health issues every single day the way we are, and so it's really important for us to bring that knowledge and challenge them in their thinking. The current beverage agreement resulted in some of this dialogue that we had before finalizing the agreement, where not only do we have a goal to reduce beverage calories consumed per person per day in the United States by 20% by 2025, but the companies are working with us in up to 10, between 8 and 10 local communities, 5 of which we've already started the work, to really do a much more intensive effort and understand what it takes, because we know that it isn't one size fits all. And so this test and learn approach was something that was novel to our agreements, and that is really going to teach us all a lot about what it's going to take to make these shifts. So that came from a lot of dialogue and that challenging each other to think about how to solve for the common value and the common goal. Being transparent is critical. There are a number of companies that make pledges, part of their corporate sustainable responsibility, which is really important. But we believe and we have found that if you have a credible third-party NGO at the table to set the goal in the first place and to figure out how it's going to be evaluated and communicated is really critical to the success of these relationships. I'll also know that our integrity is something that we're not willing to compromise on, and we accept no funding whatsoever from the companies in the food and beverage sector that we negotiate agreements with. And the third-party evaluation is critical, and I'll get into that here and show you some of the early results of the current work with the beverage companies. The current evaluator for this work is Keybridge, led by Dr. Robert Westcott, who I mentioned before, who has led a team to establish a baseline for this agreement on both the national and the local level in the 5 communities so far that we've selected. And in addition, we have some early findings from the first few communities that are pending distribution, but I'll be sharing those results right now too. So really quickly, the baseline that we're looking at per person across the U.S. right now is 199 calories per day, and our reduction target is 159. We corroborate this with a few other data sources, but you can see in the first year, we really haven't made very much progress whatsoever, which is not entirely surprising since we're looking to transform an entire system in 10 years. But this is what our reports are going to be looking like every year. And this shows you kind of the similar numbers, but from different data sources, so we can track the public data around this on a regular basis. This one from Beverage Digest, and this one from a Nielsen Scan Track. Different numbers because not every data source includes all of the same points. The long-term shifts, I think everyone is already aware of. Bottled water is leveling off. No and low-calorie sodas are not moving as swiftly, so there's a lot of headwinds. Bottom line is that there is a lot more work to be done because some of this has leveled off. And I'll just mention briefly that a component of our McDonald's agreement, as I mentioned, was the removal of the sodas from the Happy Meal. And in the first year, some really terrific results. We'll see if they're sustained, and we'll also be learning from actually 19 other countries where McDonald's is doing the same thing about what are the things that work to help moms in particular and families and children make different selections with their beverages with the Happy Meal. The sodas are not on the Happy Meal menu, but as I think Margot mentioned yesterday, if a parent asks for them, they will sell them a soda. And so this is a really important element of our work that connects two of our agreements, and we're working closely with the companies to connect the dots there, which is a really important part of the current work. From a local level, I'll just let you know quickly that I can't go, can I go back? The calories per day, per person from a baseline perspective across the 5 communities looks like this. The more important thing is that we at least now have something that we're going to measure on a consistent basis. We're also looking at just the general volume of beverages as well as the calories per beverage. A whole lot of factors going into this, and the entire methodology is available on all of our websites. Not a lot of earth-shattering news in the first year. Again, pretty much as predicted, but you can see some challenges in the parts of Little Rock where we're doing this work. There was a slight increase, and in parts of East Los Angeles and 4 zip codes where we're working there was a decrease. So again, we're learning. It's a really granular approach, and it's a lot of hard work. So just to summarize, this is one of many approaches with engaging the business sector. It's one that is completely without a public approach to bringing them to the table. It's about individual relationship building and trust building and understanding their business and finding that common goal. We're doing this work very closely now with our collaborators at the Partnership for a Healthier America and looking to combine some of the great work that they're doing related to Drink Up and the water campaign and convenience stores and connecting that to our work both with the beverage companies and McDonald's. So we're really excited about that, along with our partnership with the Robert Wood Johnson Foundation to go deeper into this work together about how to engage. I'll also just point out one last piece of this, that as I mentioned, we believe every company and every store and every restaurant in this country has a role to play. And these 3 beverage companies in Los Angeles, as an example, are calling upon, the number of stores in these 4 zip codes is 459 individual stores. 445 of them are not part of large chains, which means that the salespeople are negotiating with each store owner one by one to change the products on the shelves and some of the in-store campaigns. And that there's another 91 stores and 142 restaurants that, as I mentioned, are not serviced by any of the companies. So there's other beverage companies, other smaller companies that we hope will join into this. And as we see the success, we'll be inviting them to the table too. Some on a national level, as well as many on a local, much more granular level. So I look forward to the discussion and happy to answer any questions. Thank you.